Hello, everyone. This is Jessica Costantino from AARP in Massachusetts. You are joining us tonight for a Caregiving in Your Community event. We are so glad that you're able to join. If for some reason you are not able to stay for the whole time, no worries. We're going to have this recorded and we will send it out after the whole series completes on Thursday evening. And so we hope today to provide you with some resources. We know that caregiving can be a very overwhelming experience, but what we know from our members and research is that if you are not caring for someone currently, at some point you probably will, or you may need care yourself. And so we're hoping to bring you some resources that you can use. We have our national expert, Leslie Cyphers, on, who works on our caregiving team out of our national office in Washington, D.C. We have Mike Watson, who works on our livable communities leads out of our national office as well. And then you've got me and Antron here in the Boston office, and we're going to be bringing in some local resources as well. All of that is to say that we've got a jam-packed agenda. We thank you so much for joining us. And we're going to get right to it, talking about caregiving in your community. A couple of housekeeping pieces. If you have a comment or a question, at the bottom of your screen, you should see a bar that has what says Q&A or chat. You're welcome to put your comment or question in either of those, and we will read it and make sure that it gets addressed. And also, we will be sending this entire presentation with the slides included out after the series completes. So you should have those as resources so you don't have to take copious notes unless you really want to. So thanks so much for joining. I'm going to turn it over now to Leslie Cyphers from our National Office Caregiving team. Take it away, Leslie.
Thanks, Jess. Thanks for inviting me to join you guys today. My name is Leslie Cyphers. I work in AARP's national office on the family caregiving team. I previously worked for AARP Massachusetts for about 2.5 years, so I'm glad to be back joining you guys today. AARP is a nonprofit, nonpartisan organization that really works to empower people to choose how they live as they age. By providing resources and additional forms of support to family caregivers, AARP hopes to create a country where people can continue to live in their own homes and communities for as long as they choose. Over 48 million family caregivers provide unpaid care for family members, loved ones, friends, family, spouses, grandparents. And AARP advocates for policy changes to support these caregivers on a local, state, and federal level. AARP's research around unpaid family caregiving has highlighted the need for resources and supports for those caring for loved ones. In 2020, the Caregiving in the US report revealed that an increase in the number of caregivers ran to about 9.5 million from 2015 to 2020. So as of now, family caregivers now encompass more than 1 in 5 Americans. As of 2017, Massachusetts had about 840,000 family caregivers. Obviously, this number is about 5 years old, so the amount is probably much higher by now. These caregivers provided a total of 700 million hours of care to their loved ones. So in order to support these family caregivers in Massachusetts and in states across the country, AARP created state and local caregiving resource guides to help family caregivers access key programs, services, and agencies in their states. The first URL you will see here, aarp.org/caregiver resource guides, has all of the states listed. You can click or tap on a state to find tools and support from everything from health, legal, and financial support to respite care. I've included the URL for the Massachusetts specific guide, but of course, if you happen to be a caregiver for a loved one who lives outside of the state, you can access those guides on the first URL as well. Another great local resource is the Community Resource Finder, which is a collaboration between AARP and the Alzheimer's Association. It includes information on programs and events, care at home, community services, medical services, and housing options. If you go to this website, you can enter in your zip code or the zip code of your loved one, and it'll steer you towards resources. There we go. AARP's main website for caregiving resources is this Caregiver Resource Center that you see here. It's aarp.org/caregiving. Family caregivers can access information, content tools, and a whole host of links to outside information. We also have this website available in Spanish. AARP also hosts a toll-free specialized call center in both English and Spanish that serves AARP members and non-members who are able to call in to receive some advice in terms of resources that they can contact for more help with caregiving. The AARP Family Caregiving Guides, previously known as the Prepare to Care Guides, are designed to help develop and implement a caregiving plan for a loved one. The guides include information on how to have conversations about preparing to care, ways to assess the needs of a loved one, tips for organizing important documents like healthcare power of attorney, a roundup of federal and national resources, and checklists, medication lists, and contact lists. On aarp.org/prepare to care, we have these guides available in English, Spanish, and Chinese. We also have guides available for Asian American, veteran, and LGBTQ communities. If you go to this link, you're able to access all those guides in one place, and you can print out the PDFs as well. The nation's 48 million unpaid family caregivers not only dedicate their time and effort to caregiving, but also financial resources as well. Most of them are spending their own money on caregiving expenses. In 2021, it was estimated that over 3/4 of family caregivers, on average, they spend about $7,200 of their own out-of-pocket money on caregiving expenses for a loved one. About half of caregivers say they use their own money for household-related expenses, 30% say they covered rent or mortgage payments, and 21% financed home modifications for a loved one. I'd also like to mention that COVID-19 really magnified the duties of caregivers along with the financial burdens of caregiving, with 42% of respondents saying that they spent more time and money on caregiving during the pandemic. This AARP study really highlights the need for effective public policy to provide financial support for family caregivers. And due to this, AARP really heard that finances was something that caregivers could really use help with. And so we created one of our new resources, the Financial Workbook for Family Caregivers. It breaks it down into health, housing, money, and future planning. It's a guide to help you get organized with worksheets designed to capture essential information you need to manage caregiving and the financial responsibilities associated with it. We recommend making a copy of the completed guide to give to friends and family members who might help you in your caregiving journey. We also have this resource available for veteran and military families, and it has some specific resources for that community. Both of those URLs are on the bottom of the screen. And just a few quick additional resources. AARP has a family caregiving Facebook group where that is run by AARP staff, volunteers, consultants. It's really a place where caregivers can go to ask questions of other caregivers, look for advice for people who might be in the same situation as them. And if you would like to join, you can go to the link and you just request to join the group. You can ask questions of the other caregivers and interact with them, and a lot of people find that really helpful. There are also instructional caregiving videos focused on training family caregivers for medical and nursing tasks, which are available from AARP's Public Policy Institute. You can see one of these videos on the left of your screen on wound care. The whole video series are available in English and Spanish. These are fairly short videos. AARP also hosts a lot of webinars. You can view them live at learn.aarp.org, And after they are all live, they are recorded and put up on our website so that you can view them on demand as your schedule allows. These are chats with speakers. They can answer participants' questions on a whole host of issues. And we rounded up all of the ones related to caregiving and put them all in one place on this URL. Thank you for having me join you today. I've included our email address below, but the best place to start if you have any questions is always to talk to my state office colleagues, Jess and Antron, who can surely point you in the right direction.
Thank you so much, Leslie. That was jam-packed with lots of information. It really shines the light on why we are working on this issue across all of AARP. I did see a question that said, will we be sharing this presentation? And the answer is yes. If you joined late, this is going to be recorded, and we will share this after the whole series completes on Thursday evening. So you don't have to take copious notes if you don't want to. We will have all of these links, etc., for you. We also know that caregiving is one piece of AARP's approach to trying to make sure that people can age as they want in their community with dignity. So I'm going to turn it over to Antron, who's going to talk about that aspect of our work and how it dovetails with caregiving. Take it away.
Awesome. Thank you so much, Jess. So as Jess said, caregiving goes well beyond just in the home. It really expands to our communities, and how can that be a factor in helping us become caregivers or caring for our loved ones. So in that respect, I'm going to actually turn it over to my colleague, Mike Watson, who's going to talk about AARP's livable communities work across the country.
Thanks, Andron, and thanks, Jess and Leslie. It was great to be here and hear more about our caregiving work. As Antron said, AARP also works in communities. While we work to support family caregivers, we also work to improve communities so they're great places for all ages. And we know that the reason that we do that is because we know that people want to remain in their homes, they want to live in their homes, and they want to live in their communities as they grow older. We know that is for a host of reasons, a lot of which is because these are your communities, these are your neighborhoods, these are the places where you have grown up with your family, grown close to your neighbors, you're close to your where you want to go to the doctor, where you shop, your coffee shop. We all want to live in the places that we're living today and want to age in the places that we're living today. So we've heard this over the years from our members, and it's really the reason that we work in communities to improve them so they're great for older adults and great for all ages. One of the ways that we approach this work is we work with communities and encourage them to look at their infrastructure, look at their resources, and look what they are providing to their communities, and think about the needs of older adults. Because we believe that if you create a community that is great for an older adult, it is going to be great for people of all ages. It's going to be great for their children. It's going to be great for their grandchildren. It's going to be great for their neighbors of all ages. Because again, if you build and design a community around those unique needs of an older adult, it really is going to support a community that is great for all across their entire lifetime. And the way that communities are principally working with AARP to do that is through a program that we have called the AARP Network of Age-Friendly States and Communities. Massachusetts is a leader in this across the country. There are more age-friendly communities in the state of Massachusetts than almost any other state in the country. And the state of Massachusetts is one of the first states to enroll in the network of age-friendly communities as a state, really signaling a statewide commitment to being a place that is great for all ages and taking action, not just planning, not just printing out things to put on a shelf, but actually reaching out to people, listening in conversations like today, and taking action. We saw this firsthand in response to COVID-19 as communities across the country that were prepared and had done the hard work to reach out to older adults, listen to them, hear their concerns, develop these action plans and begin implementing it, were frankly better prepared to respond to the pandemic and probably saved a lot of lives in the process of that. And this really ties in. I think many of us are experiencing this in our day today and also during the COVID-19 pandemic, that caregiving is a really important driver when it comes to livability of our communities. And it's a driving issue when you look at the communities that are part of the network of age-friendly communities and why they're joining. I'm going to highlight a few ways that we see communities across the country responding and taking action to support family caregivers and older adults as they're doing their work. The first I want to highlight is communities and how they are supporting family caregivers and providing information and resources. So Salem, Massachusetts is a great example of this. During the pandemic, they had 206 volunteers reach out and contact 6,000 older adults at the peak of the pandemic to ensure that they had what they needed when it came to health, when it came to nutrition, when it came to telehealth, to help ensure that they were connected and they were safe and they had the resources that they needed. In Ridgewood, New Jersey, not too far away, but far enough away, the community worked to develop a network of retired medical professionals who are then working to train older adults and train family caregivers on some medical tasks. If those of you who are a family caregiver, you know that there are at times you're given a handful of instructions from a doctor and expected to go do some really complicated medical tasks. Leslie talked about that a little bit earlier with the training videos. Having this little bit of extra handholding and support from a fellow community member can make all the difference. Another way that we see communities taking action to improve the lives of family caregivers across the network is by increasing access to affordable and reliable transportation options. I think we all know how difficult it can be to get a ride across town or coordinate a ride for a loved one who needs to see a medical professional or get somewhere else. So Pittsburgh, Pennsylvania, in the peak of the pandemic, used volunteer drivers to deliver kind of medically necessary equipment, PPE, to folks to support them. And also, as the pandemic eased and more safer restrictions were put in place, we're able to transmit folks across the community to medical appointments and more. And then Chelmsford, Massachusetts has done a very similar thing with a volunteer transportation program where volunteer drivers are trained, are safe, and are able to kind of transport folks across town to medical appointments and other necessary needs. The final way I'll highlight that we see communities really taking action to improve the lives of family caregivers is in the area of housing. Working to improve housing options, so there are more ways for people to live and age in place, and also improving the accessibility of housing. So Jackson, Wyoming, on the other side of the country, has done a really neat program where they created a co-housing arrangement where folks from multiple generations, younger adults and older adults, could live together, form some of those bonds across generations, and also provide a new affordable living arrangement for older folks who may be looking for a little bit of companionship and partnership, and younger folks who needed that kind of cross-generational support and a little bit of a more affordable housing option. The other option I'll highlight, the other way I'll highlight, is in Madison, New Jersey. And we've seen this across the country in other places where the community created a program and a fund to help finance accessibility improvements to homes to help family caregivers make the improvements they needed on their property so they could have a loved one live with them, or on a loved one's home, so that they could age in place and remain in their home and in their community where they want to be. The last thing I'll highlight, which I know has been a movement across the country, in Massachusetts as well, is what we call accessory dwelling units, or ADUs, which, if you've been around ARP, you know we love acronyms. But what this is it is a smaller house, a smaller unit that is on the same property as the primary residence. And what it's going to do is allow an older adult who's aging to have somebody live there who can help provide a little bit of income, provide some support. So it could be a family member, or it's an option for them to live in and be close to family members, but not necessarily living in the same house as your children and grandchildren. So again, we've seen this across the country, and we know that 70% of people over the age of 50 would consider living in an accessory dwelling unit to help provide a little bit of care. So that's really what we're seeing across the country. I want to highlight really quickly some of the ways that you can learn a little bit more, and some ways that you can access some resources from AARP, in addition to the fantastic resources that Leslie shared earlier. So first, you can go to aarp.org/livable. And that is going to give you information and resources on all the topics I talked about earlier, as well as more on ways you can think about improving your community, on ways you can contact your local elected officials to improve public spaces, walkability, transportation, and housing, and more. There's going to be a lot of great resources there. Two other ones I want to call out is AARP's Home Fit Guide. That's available there, or you can go to aarp.org/homefit. And this is a step-by-step resource and toolkit with checklists and everything you need to kind of assess your home, look around your home, and identify the improvements you can make so that it can become a home for you for the rest of your lifetime, and those who may live in it beyond you. Finally, the last thing I'll highlight is the AARP Livability Index, which is a tool that allows you to insert your zip code or your address and look at how your community ranks compared to others on core factors of livability, and help you identify where you believe your community might be strong, might be weak, and you might want to volunteer with AARP Massachusetts, talk to local community organizations, and maybe call your local elected official to ask them to think about older adults and family caregivers as they're envisioning the future of their community. So with that, I just want to thank you so much for having me today. Thank you for being here and listening to and participating in this important conversation. I know I speak for my colleagues in AARP Massachusetts, Antron and Jess and others, when I say that we look forward to hearing your questions later and answering them. So thank you again, Antron. I'll kick it back to you.
Awesome. Thank you so much, Mike, for that wonderful explanation of how AARP is really engaging communities, community leaders, and organizations and the like to really support a change, positive change in the communities, to really make them livable for all of us. So a lot of what Mike really drove down in was on the national level. I'm going to take a couple of minutes here to really dive into what's happening here in Massachusetts. Let me share my screen. All right, so as Mike mentioned, an age-friendly community is one that is accessible, equitable, inclusive, and safe, and secure and supportive for people of all ages, really allowing people the opportunity to live as they age. Apologies. All right. Another part of that really around the initiative is allowing for older adults to really play a crucial role in that process, really raising the voice of our older adults and keeping them included in the process really makes for a better community. Because if you're taking care of your older adults, you're taking care of everybody behind them, all the way down to the youngest individuals in community. As Mike mentioned, there are several areas that we focus on. Here, these are the domains of livability. Key ones that we always hear about: transportation, housing, communications, and our outdoor spaces. But as you see here in Massachusetts, we are working on age and dementia friendly. So we will cover a number of areas, including public safety. Civic participation is huge. Because again, we want to raise your voices and get them to the proper individuals so that changes can be made in community. So if you look at the map here, Massachusetts, you'll see the green hearts and the red hearts. They really just signify the number of communities here in Massachusetts. We have about 90 plus communities who have made that commitment to working with their residents. Leadership has made the commitment to working with their residents to really engage in listening. And we'll take the changes, take that listening and implement it over a course of 5 years. Here we have about 100 and I guess 100 communities, I would say specifically, that are doing dementia. And of the combination, I think we're right around 80 or 90 who are also doing both of the initiatives at the same time. And as you see, we're working on a number of regional efforts, which we're finding really brings in a lot of those unusual suspects when we talk about the collaboration at the community level. We have MetroCom 2050, who is now incorporating age and dementia friendly principles in their master plans. Same with the Pioneer Valley Commission and Central Mass. Again, as we talk about stakeholders and those organizations collaborating, one of them is Salem for All Ages. Mike mentioned them in his comments. They have a wonderful program there, really led by a key volunteer in the community. So it doesn't have to be a full elected official or a hired individual. Volunteers can play a crucial role in making positive changes in their community. So Salem for All Ages is one of those. We have Age Strong in Boston. We have Coastline, who is leading an effort down in the South Coast region. Public Health. We have all sorts of groups throughout the state. And Healthy Martha's Vineyard is another example of a region, communities coming together to accomplish the goal of making the community great for people of all ages. Here, I just want to give you a couple of examples of how communities are doing this. So during the pandemic, the RMV actually created special hours specific for older adults to come in and take care of necessary paperwork, getting license, registration, so on and so forth. It's just a concerted effort to ensure that older adults had the opportunity to accomplish what they needed to remain in the community. Down here on the bottom left is actually an example from Lawrence, where they piloted a free bus fare program, which has now become a staple in the community. And the route that is free actually brings folks by where many of the jobs are, schools, medical, doctors, so on and so forth. Another example, kind of top middle here, really shows how a community is really putting people first, reimagining what it is to be in a community, adding in protected bike lanes, crosswalks, sidewalks, making sure that those are available. And again, these changes and modifications to communities benefit everyone of all ages. So if you're looking for more on the initiative as a whole, you can always go to arp.org/livable, as Mike said. Another local partner here in Massachusetts is the Massachusetts Healthy Aging Collaborative. I know it's a mouthful, but they have lots of great resources there that really talks about what's happening here in Massachusetts, not only at the community level, but at the state level as well, with the Executive Office of Elder Affairs, who is really a leader in the Massachusetts age and dementia friendly efforts statewide. So I'm actually using slides from my colleague, James Fuccione. So if you have any questions about the Massachusetts Healthy Aging Collaborative, you can find that information here. But what I'm gonna do next is actually gonna stop sharing my screen, and we're gonna give you the local person. We unfortunately had someone lined up for the South Coast, but they were no longer able to make it tonight. But what we are going to do is show you a clip from another person who had some really great information regarding AAA's, aging service access points, just a really good resources for caregivers in general. And although it's not in the specific South Coast region, it is fully encompassing of the programs available around the state. So obviously I'll let her speak and we'll go from there.
Coordinator of Age and Dementia Friendly Cape Ann. We're a regional age and dementia friendly initiative working with the 4 communities of Cape Ann. That's Essex, Gloucester, Manchester by the Sea, and Rockport. So I know that today we're supposed to be talking a little bit about resources for caregivers. So I'm going to speak generally at first. I always kind of think about 2 different groups when I think about caregiving. The first is area agencies on aging. In Massachusetts called Aging Services Access Points. And then the second are councils on aging. I'll start with area agencies on aging. They are kind of the regional hub for home care services. In our region, that's senior care. We serve the communities of Beverly, Essex, Gloucester, Hamilton, Ipswich, Manchester by the Sea, Rockport, Topsfield, and Wenham. And essentially, we're a consumer-centered organization that provides and coordinates services for older adults with the goal of enabling people to live independently at home or in a setting of their choice while remaining a part of their community. So that's kind of the overarching goal of senior care and all area agencies on aging or aging services access points. We can help people if they're over age 60, or if they're an adult living with disability, or if they're a family member or a caregiver for someone in that group, or if there's somebody who's concerned about an older adult or an adult living with disabilities. And how do we do that? Senior Care provides a wide array of programming, from direct in-home services like case management and home care services, Meals on Wheels, that type of service, to more informational resources such as care options counseling. So kind of understanding the options that are available to you. Informational resources are free. It's a free service provided by the state. And then case management and additional home care services, there may be a fee associated with that, but that is managed through the information resources. Another great way for caregivers to kind of access information and resources and build their network is through a caregiver support program. We have that here at Senior Care, and what our caregiver support program does is it kind of provides that information piece. It provides direct support and help navigating caregiving for somebody who may have kind of individual questions but doesn't want to access services. And then we also offer free support groups. They meet monthly, sometimes in person. We also have virtual options via Zoom for those who would prefer that. So that's kind of the quick summary of services through an area agency on aging, such as Senior Care. And I encourage people to call and ask for more information. And folks can walk you through kind of what's available to you, what makes sense for your particular situation. Similarly, I always encourage people to reach out to their councils on aging. This is a place, a local council on aging is a place that knows your community inside and out. They're part of your municipal government. You can access them either through Town Hall could give you the number. I mean, the number's widely available. And they provide local outreach. They provide social and health services. So there are activities within a senior center setting. There's meals available. They also provide information and referral services for families and caregivers. I can't speak specifically to all that the COAs in our region do because there's so many and they all do different things, everything from transportation to support groups to fitness classes. So it's good to connect with them and see what is out there for you. So those are kind of the two big buckets that I think caregivers are great places for caregivers to start with in our region. And then I thought I'd take 1 minute to kind of discuss some of the local activities or resources that are happening. And you can learn about all of these through Senior Care or through your Council on Aging. But we have a nice new program that is a collaboration between Age and Dementia Friendly Cape Ann and the Essex County Greenbelt, where we're running dementia-friendly walks. So it's basically a short walk that is an inclusive sensory experience meant for those who are living with some kind of cognitive changes and their care partners. Sometimes care partners come on their own without the care recipient. Sometimes it's kind of both caregiver and care recipient. It's a great way to meet others in a really relaxed environment. Outdoors, there's plenty of seating, there's restrooms, parking is available close by, and the walks are tailored to who is there. So, they can be a longer walk or a shorter walk depending on who's attending. In a similar vein, as we're thinking about those who are living with cognitive changes, the Ipswich Council on Aging runs a memory cafe, which is really a friendly gathering space for people who are living with memory changes and their care partners. It's coffee and refreshments, conversation, sometimes simple activities. So that's a nice way, again, to kind of mingle and get to meet folks. In terms of thinking about those who may be homebound, on Cape Ann, we have the Cape Ann Virtual Senior Center, which is intended to bring senior center programs to the comfort and safety of the home. So programming, fitness programming, arts programming, special activities, concerts are broadcast through the public access television network, and anyone who would like to can access them at any time. It's a great way to access some programming and entertainment, but in your own home. Finally, for those who want to get out, there's a couple other outdoor activities. Age and Dementia Friendly Cape Ann has an Outdoors for All Ages program, which kind of looks at the wide array of outdoor spaces that we have here on Cape Ann and on the North Shore. And provides people with information about local walks and hikes so that people can access the outdoors with confidence, so they know kind of what to expect. Is there things like terrain, restrooms, parking, so you can find the right fit for you. Rest Stop Ranch in Topsfield is an accessible garden offering programs for older adults and their care partners. So again, it's if you have a wheelchair or a walker, it's easy to kind of meander through the garden. There's some programming often involved, some social programming. They move it indoors for the winter, but on site there. So that's a great resource to check out as well, and a nice way to build your network of people who are kind of experiencing similar things. So I've taken my time. I'm going to have Antron put my contact information in the chat. Please feel free to reach out if you have any questions about any of these individual programming or any other questions. And thank you for letting me send a recording today.
Thanks so much, Antron, for showing us that while that focused on the North Shore, we know that there's the relative equivalent happening on the South Shore as well, on South Coast. For example, she mentioned the memory cafe that happens. In Duxbury, they have a memory cafe that's happening at the South Shore Conservancy. And, so if you live there, or Hanover does a whole set of programming that's virtual through their partners with their cable TV station and other program. So I think really what I learned from her is that your Council on Aging is a really great place to start the conversation. There are so many resources, and they will know most likely what's happening on your community level. I think we want to make sure that people here know that this is hopefully a no wrong door approach. While we've given you a lot of information and we have a lot of things to cover, there are resources available. ARP has a lot of them. I'm assuming everybody caught the theme of it. Usually starts with www.aarp.org, and then you go from there. Bunches of resources there if you have time. We know caregivers are super busy and don't have a lot of extra time, but we also have heard that sometimes they're, scrolling in the middle of the night when their loved one has finally, been helped and they've got, a few minutes to do something. So we're going to try to do that. One of the things we didn't mention was how people could get involved if they want to do more. I work on the advocacy side of the organization, and elected officials and policymakers really want to make changes based on what they hear from constituents. And that's all of you on this call. And so what we know is that a story is much more effective, even though Leslie and Mike and Antron have all shared really important facts and data, that a story about how caregiving is impacting you really goes a long way. And so we want to make sure that we are helping caregivers on the policy front as well. And if you want to get involved, I'm going to give you another place to go, but hopefully this one is really easy for you to get involved as an activist. aarp.org/get involved. And if you sign up there, you'll get periodic updates. One of the things we're working on here in the state is getting a family caregiver tax credit. What would that be? If it gets passed, it would mean $1,500 refundable tax credit to people in Massachusetts who are doing caregiving for someone else. There are some requirements of eligibility, but it's a very broad set of requirements. And so we encourage you to take action with us if these issues matter to you. Also, if you want to be involved in the livable, age-friendly community side, which is, as Antron mentioned, your voice matters. You help set the direction for your community. And so it's aarp.org/livable. We do have some resources. The ARP Family Caregiving Guide at ARP Prepare to Care, the ABCs of ADUs, as Mike mentioned, we love our acronyms, but figuring out how or where or what the rules are to build an accessory dwelling unit, that can be overwhelming, but it might really be the thing for you, and we've got a guide to help you there. Or maybe just taking a look at what's happening in your own home. Do I have enough light in my hallway so that I can safely get through there at night? Are there area rugs that really either need to be taken up or glued down so I don't go tripping? The other thing is we work with volunteers. There's 9 of us in the Massachusetts State Office. We could never do all that we're doing without the help of volunteers and ARP members. We have a whole host of activities that are happening. And one of the things that we would love your help with is if you are someone who likes to do presentations, we have a way that you can join us. We have what's called a speakers bureau. And we host DIY presentations. DIY is such a thing to do now. We've got a whole television channel set up for DIY, right? So on caregiving, you could do a presentation that would help people go through how they can prepare to care as a caregiver, what that would mean. And you could do this. We would assist you. We would provide you resources and we could help set you up with that. But we would love your help there, because we are always getting requests on how we can do more presentations out in the community. And you might know a group that's interested in having a presentation. Are you part of a book club? Are you part of a community action group that really would like to know about this? So there's a lot of ways to get involved with us. Both Antron and I are happy to take calls and comments and emails directly. As I said, we will be posting this. So after the series ends, we will post all of this so you can have all of this information as well. But we had a couple of people who asked questions in the chat, but this has been a relatively quiet group. Antron, do you have any comments that you think might prod people to ask another question or make a comment?
I would say one that actually came up earlier was who's a caregiver. I think that's always one to define. That's one that we always really need to define. And I think the answer we had earlier was that anyone who is caring for another person is a caregiver. I think, what did we say, 50 or older at one point? I think that was the age. But I say this for the 60 or older, for some of those programs. But if you are caring for someone, you are a caregiver. If you're calling someone to check on them, you're a caregiver. If they aren't in the same home with you, but they live in another state, and you are making sure that their needs are being met, you in fact are a caregiver. So let's not forget, or I guess that's one of the things to know. If you're unsure if you're a caregiver or not, that you may be a caregiver.
Yeah, I think that's a really good point. And a lot of the programs that are offered through either the Aging Service Access Point or the Commonwealth of Massachusetts are specifically for people, as you say, 60 and over. But one group that is carved out, that is with younger people, are grandparents caring for grandchildren. There is a whole program in Massachusetts if you fall into that. And most of the time, ARP does its work for people who are adults, and we leave the kids stuff to the groups that really do a great job there. But grandparents raising grandchildren is an area that we know is a very unique set of needs, and really we have some resources directed for that particular community. So if you know of someone in that group and doing caregiving, happy to provide the resources there. Seems like a very quiet group. I don't see any more in the Q&A. No one's saying in the chat. Oh, we have a brave person who wants to say something terrific. What are the qualifications and requirements for someone to host a DIY presentation? Can you elaborate on some of the examples of presentations and presenters that have happened in the past? Absolutely. And we are fortunate tonight to have one of our colleagues who actually runs our volunteer programs in the Massachusetts State Office. Her name is Kelly Leffler. I'm going to give her a second to get her computer to catch up with what we're doing here. But we do presentations, and the requirement is that you are willing to work with us to look through the materials, make sure you understand the materials, and that you can deliver the materials. They are on a host of issues. So one of the things is on caregiving. Obviously, that's tonight's subject matter. But we also know that sometimes people might want to know about how to prevent fraud. We know that's a really important issue. Another piece that has come up time and time again is how to make sure that you are brain healthy, right? We all want our brains to keep working. And if there are things we can do to help enhance that as we age. So Kelly, I'm not sure if you're able to jump on, and if so, I'm going to turn it to you because you're the expert on this.
Yeah, I'm here. Thanks. And what a great question. Thanks for asking it. So to get a little bit more into the specifics of the requirements, when we have a new volunteer presenter, we usually have some one-on-one time with them to talk a little bit more about the specifics. And then if they have a particular presentation that we're interested in, we make sure that they have all of those materials. And then we just ask that they give us kind of like a mock 10 minutes of the presentation type of thing. And then we have a volunteer panel that gives feedback, and then you're good to go. So, and usually your first presentation you would do as a co-presentation with another volunteer. So there's really a lot of support. Some of these presentations are virtual, some of them are in person, but that is completely up to the volunteer's comfort level. We will never ask you to do something that you're not comfortable with. If you're not so sure about the public speaking piece, we also have volunteers that are doing a lot of support. So we have volunteers that are helping us with scheduling the presentations. We have volunteers that are helping to train other volunteers. In fact, we actually have an in-person Speakers Bureau training or DIY presentation training this Friday in Natick. And then the following Friday on the 14th, there is a virtual presentation or a virtual training as well, if you're interested. So I can give you that information. What I'm going to do is, oh, Jess already beat me to it. She put my email in the chat as well as her email and Antron's email. So my email is that last one, kleffler@aarp.org. So if you're interested in learning more about our DIY presentations, I'm happy to chat with you. Please just shoot me an email. And so the question is it always predetermined AARP material being presented in these DIY presentations? Good question. Most of the time, yes. And Jess pointed out some of our more popular presentations. We also have things that are a little bit on the lighter side. We have presentations on decluttering and downsizing, keeping yourself, safe online so you can spot misinformation. But it's possible to do something that's not necessarily AARP material. It's just a little bit more difficult. So for instance, we had a volunteer who is a substitute teacher in Massachusetts in his retirement. And so he's giving a presentation on, how to go about doing that. If people are, nearing the age of retirement or if they're already retired. But generally speaking, yes, it's predetermined AARP material. They're usually between 30 to 60-minute PowerPoint presentations. There's a script that goes along with it, but I usually encourage volunteers to personalize it, to tell personal stories, and connect with their audience that way.
Thank you, Kelly. Thanks so much. I did ask the person if you are concerned about something in particular that you would be interested in presenting on, or are you trying to find out about other presentations for groups that you are part of? If so, just let us know. And you have now our email addresses and we can try to work through that. I do see a comment about someone who's a caregiver for someone who has both physical and mental behavioral limitations. And so where can you find information about an accessible vaccination spot? Well, not only does Massachusetts have accessible vaccination spots, but Massachusetts has an in-home vaccination program. And I've put the link I'm assuming that it's vaccination, not vacation. But is it vacation? Oh, it is. Okay. I'm sorry. I misread that. I was thinking vaccinations. Just so everybody knows, we have an in-home vaccination program in case someone needs services to come out to your home if you have a caregiver for someone who can't get around. Where can I find out about information for accessible vacation spots? This is a question I have not heard before. Antron, have you heard about this? Or how about our national office folks? Anybody of the presenters, have you heard about accessible vacation spots? Oh my goodness, someone just put in that we have an ARP travel site that has information and accessible tour companies. And so terrific. Look at that. If anybody wants to add, we can, anybody has other information that they want to share, by all means, let us know. We're not vacationing too much. We're not the vacation experts. Darn. Hopefully that will help you. Kelly also just put into the chat the information about the presentation trainings, virtual and in person. And by now you probably know that we are moving into a space that is, some people are comfortable being in person, some people really want to be in a virtual space, and we are trying to accommodate for both of those things. And so you'll see us talking about different presentations in person, different things in person, activities, events, and then others that we're going to be doing virtually. And we're going to continue doing both of those. So if you don't have any other questions or comments, I am going to turn it back over to Antron to do the wrap. So thank you so much.
So before we go, I know one of the questions I saw in the chat was around where do you start? There's a lot of information shared today. One good place to start is Mass Options. They have caregiver support network. They're able to help you with that one-on-one counseling to assist you with some of the decision making you're going to have. Finding respite care, transportation services, everything caregiving. They're able to help you out. So if you're looking for a place to start, Mass Options is a great place. Or if you're just looking to get some items in order. Many of the caregiving resources that were shared both by Leslie, Mike, myself, and Jess today really help you lay the groundwork for being a caregiver. With that, I do want to thank everybody for attending tonight. I want to thank our speakers, Leslie, Mike, Kelly, Jess, for really being here and sharing the wealth of information that ARP has to offer on caregiving, as well as our speakers who weren't here today, Carrie Johnson, who really offered some great information on the resources around the state. She harped on it a good bit, but Council on Aging's. Those are great places to really get a lot of information that can support you in your caregiving journey. So with that, I want to say thank you. Gonna look at Jess one more time, see if there are any last minute questions. But otherwise, I want to say good night, and I hope you all reach out to us, and we look to stay in contact. Have a wonderful evening.